Welcome guys. Here I'm going to be talking about green tea and its benefits with cancer. So let's dive in. There are over 100 clinical trials on green tea and its benefit on cancer prevention. But let me tell you the overall of it. Compared to the highest consumption of green tea to the lowest consumption, the difference in the benefits of cancer prevention was 17%, which is a big number. In a prospective clinical trial of 472 Japanese women with invasive breast cancer stages 1 to 3 were found that those who consumed about 4 cups of green tea or more, post-surgery recurrence rates were reduced in stage 1 and 2. If they consumed more than 4 cups, they had lower recurrence rate up to 17% and their average disease-free period was up to 3.6 years. A meta-analysis of about 17 studies were conducted. In Asians who consumed green tea, they had a lower risk of bladder cancer. Risk reduction was up to 19%. Epidemiological studies have correlated the consumption of about 8 to 10 cups of green tea with a reduced risk of colon cancer as well. After adenomas or cancerous tumors were removed, they had them followed up with green tea consumption and found that there was a 15% recurrence rate in green tea group as opposed to the recurrence being higher up to 30% in the non-green tea group. A study of about 439,000 and odd patients in which consumption of green tea showed reduction of about 21% risk in women. As regards to the gynecological cancers, it had a 22% risk reduction in endometrial cancer. About more than 60,000 subjects were followed in a prospective study over an average of 15 years, and they found that women who consumed on an average about 2 or 3 cups or more had an average risk reduction of about 46% in ovarian cancer. There was a double-blind placebo-controlled trial in which they found that consumption of 600 milligrams of the green tea extract showed a 30% reduction as opposed to only 3% in the control group. A large Chinese study found out that if you consume 1 cup of green tea for over 20 years, there was a risk reduction in leukemia from about 58 to up to 80%. Next cancer that we'll discuss is glioma, in which consumption of green tea has shown a 16% reduction in risk. Green tea catechin containing ointment on anogenital warts increased its clearance. Similar effects have been shown in HPV-associated anogenital warts and also in mild to severe cervical dysplasia, which is early cancer of the cervix. From this Wellness Wednesday onwards, let's start brewing wellness one green tea leaf at a time.